Hi, my name is Stephanie, and this is my persuasive speech on organ donation. Hopefully, once you hear this, you will want to become a donor as well. There is a big need for organs. Donation is the giving of an organ and tissue to help people in the need of a transplant. One organ and tissue donor alone can help more than 10 people. This relies on donors and their families agreeing to donate organs and agreeing to donate organs and tissue after death. Signing up to donate is painless. To donate a person, you must be able to be a blood type match. Regardless of age, race, and ethnicity, anyone can register and donate. All you have to do to register is to sign and fill out some personal information. Promoting research with organs, transplant, and patients. There are many things that can happen with an organ donation. The recipient of the organ can reject the organ or can get sick or get an infection. Donors can have an infection, but that is very low risk as well. When people in end-stage organ failure, they must go through a lot of stages and studies before they can receive an organ or tissue, which are blood tests, organ function tests, and many more. The articles researched by the National Institute of Health. There should always be an advance directive for patients in the need of a transplant. There is shortage in organs. Research should be done when you are considering to be a donor as well, just to know all the pros and cons. Organ donation is a great thing. Saving lives. There are many celebrities that have received organs or donated. Selena Gomez is one of them. She's a singer and an actress. She underwent a kidney transplant due to having lupus. Steve Jobs had a transplant of the liver. George Lopez had a kidney transplant. David Crosby and many more celebrities. Donating life. There are many different types of donations. Some of them are living donation. The donor is alive and is donating at least one organ. Deceased donation. The donator is not alive, unfortunately. But when you're deceased, you can donate your eyes, your tissue, your skin, all your organs, and many more. Vascularized composite allografts. These are a little more tricky. They call it VAC for short. This is the transplantation that may include skin, bone, muscles, blood vessels, nerves, and connective tissue. There are even face and hand transplants, which is rather new, and even pediatric donation for little ones. Research for donating. When it comes to ethics and donation, it is vital to know the pros and cons of organ donation, which I talked about earlier. The National Institute of Health is the world's top research hospital for rare diseases, rare forms of cancer, and many more. A person is put on the organ transplant waiting list every 10 minutes. That really says how in need people are of organs. Donations saves lives. Transplants give thousands of people in need of organs. Living donors saves 2 lives alone. Deceased donors can donate eyes, organs, and tissue at the time of their death, but they are limited to how many hours that can still be donated. Kidneys are extremely hard to come by. Cystinosis is a rare genetic metabolic disease. There is a lot of research that goes into this illness as it is so rare. Cystinosis causes the amino acids of cysteine to build up in many organs of the body, including the eyes. This is my story. I had a kidney transplant in 2001 due to me having cystinosis as well. My father donated his kidney to me. I grew up taking all kinds of medication and eye drops so I don't go blind. And this all just kept me alive as research continued on throughout the years, even today. I spent a lot of time in the hospital due to me being sick and so many new medications and tests and everything going on. Very overwhelming for a child. If I don't take my medicine, I will die and go blind. This disease is so rare that only 2,000 people worldwide have it. And organs are a major need as well for this disease, where we can use heart, eyes, kidney, many more. Thank you.